TechScan presents the T-Scan Training Library video, Scanning Techniques. By the end of this video, you will be introduced to 3 types of scanning techniques. Topics: standard closure, multi-bite, and excursions. Reviewing proper sensor placement. Insert the sensor by rotating it into the mouth, similar to an impression tray. Have the patient open their mouth slightly. Use the edge of the support to pull open the patient's cheek, while pulling the opposite cheek open with your finger in order to widen the mouth opening. Insert the sensor so that the position guide gently touches the central incisors at the midline. Hold the sensor in place so that the sensor is level with the occlusal plane. Note: only perform a scan after sensitivity is adjusted. Standard closure scan. After positioning the sensor into the patient's mouth, press the scan button on your T-scan handle. Instruct the patient to bite firmly on the sensor and then open. Press the scan button again to stop scanning. When completed, the black force line in the graph rises, peaks, and drops to 0. Multi-bite scan. A multi-bite scan confirms that the patient has repeatable closures. Repeatable scans are confirmed when the black total force lines for each bite have similar shapes, and the center of force trajectory pattern is consistent between each bite. If this is true, then choose the black total force line that has the highest peak to use in your evaluation. If this is not true, repeat the multi-bite to confirm that the repeatability is not achievable in this patient, and choose the black force curve that you believe best suits your patient's bite. Note: TechScan recommends that you perform a multi-bite anytime you evaluate the patient's bite for balance. To perform a multi-bite, position the sensor into the patient's mouth. Press the scan button on the T-scan handle. Instruct the patient to bite firmly 3 times. Press the scan button again to stop scanning. When completed, there should be 3 black force lines, and each should rise, peak, and then drop to 0. Excursive and protrusive scans. TechScan recommends you perform excursive and protrusive scans anytime you suspect potential interferences in a patient's bite. To capture excursive and protrusive movements, position the sensor into the patient's mouth. Press the scan button. Instruct the patient to bite firmly on the sensor and then slide laterally, either left, right, or forward, as desired. Once the patient fully completes the movement, have them open their mouth. Press the scan button a second time to stop scanning. When completed, the black total force line should rise steeply, peak, and then slope downward toward 0. This concludes the T-Scan Scanning Techniques training. For additional help, please contact TechScan at 1-800-248-3669. Thank you.